Have you ever imagined a life where sleep, that essential human need, becomes your tormentor? A world where you're trapped in a waking nightmare, unable to find rest. Welcome to the chilling reality of fatal familial insomnia, or FFI, a rare and devastating prion disease that robs its victims of sleep, ultimately leading to a tragic end. Join us as we delve into the science behind this mysterious illness, exploring its causes, symptoms, and the ongoing search for a cure. At the heart of FI lies a genetic mutation, specifically a mutation in the PMP gene, located on chromosome 20. This gene provides instructions for making a protein called the prion protein, or PARP. In FI, this mutation causes the prion protein to misfold. This misfolded protein then begins to accumulate in specific regions of the brain, primarily the thalamus, a crucial area for regulating sleep and other vital functions. This mutated gene is inherited in an autosomal dominant pattern, meaning that if one parent carries the mutated gene, there's a 50% their child will inherit it and ultimately develop FI. So, what exactly happens in the brain of someone with FI? The misfolded prion proteins act like infectious agents, converting normal prion proteins into the abnormal form. This triggers a cascade of events, leading to neuronal damage and ultimately, cell death, specifically within the thalamus. As the thalamus degenerates, its ability to regulate sleep, wake cycles, hormone release, and other autonomic functions is severely compromised. This disruption leads to the characteristic insomnia and a host of other neurological and physiological disturbances that define FI. FI is incredibly rare. Because it's genetically determined, it is generally found only in families who carry the mutation. Fewer than 40 families worldwide have been identified with the gene. The age of onset typically ranges from middle age, usually between 30 and 60 years old, but can vary. Due to its rarity, precise epidemiological data is challenging to obtain, highlighting the need for increased awareness and research. The symptoms of FI are progressive and debilitating. The most prominent, of course, is intractable insomnia, often resistant to traditional sleep aids. But the disease manifests in a variety of other ways. Patients may experience panic attacks, phobias, and hallucinations. Autonomic dysfunction is common, leading to changes in heart rate, body temperature, sweating, and blood pressure. Motor symptoms can also emerge, including myoclonus, sudden muscle jerks, ataxia, loss of coordination, and eventually dementia. These symptoms progress relentlessly, leading to complete physical and mental deterioration. Diagnosing FI can be challenging, especially in the early stages. A detailed family history is crucial, along with a thorough neurological examination. Polysomnography, or a sleep study, can reveal severe disturbances in sleep architecture. Genetic testing for the PRMP gene mutation is the definitive diagnostic tool. Brain imaging techniques, such as MRI or PT scans, may show thalamic atrophy or hypometabolism, although these findings are not always present early in the disease course. Cerebrospinal fluid analysis can also be performed, although the results are often non-specific. While FI is primarily a genetic disorder, a similar sporadic form exists, known as sporadic fatal insomnia or SFI. Unlike FSI is not inherited and occurs randomly. Though rare, sporadic fatalism is similar to FFI in terms of symptoms, affected brain regions, and pathology, but differs in the genetic origin of the misfolded prion protein. Unfortunately, there is currently no cure for FI. Treatment focuses on managing the symptoms and providing supportive care. Sleep medications are generally ineffective and can sometimes worsen the condition. Experimental therapies, such as immunotherapy and gene therapy, are being investigated, but their efficacy remains uncertain. Supportive care includes managing autonomic dysfunction, providing nutritional support, and addressing psychological distress. Ultimately, the goal is to improve the patient's quality of life and provide comfort during the progression of the illness. As FI is a genetic disorder, there is no way to prevent it in individuals who inherit the mutated gene. Genetic counseling is crucial for families with a history of FFI, allowing them to understand the risks and make informed decisions about family planning. Preimplantation genetic diagnosis at PGD is also an option for couples undergoing in vitro fertilization, allowing them to select embryos that do not carry the mutated gene. The prognosis for FFI is grim. The disease progresses rapidly, typically leading to death within a few months to a few years after the onset of symptoms. The exact duration varies depending on the individual and the specific mutation. Research into prion diseases, including FI, is ongoing, with scientists exploring potential therapeutic targets and diagnostic tools. Recent advances include the development of more sensitive diagnostic assays and the investigation of novel therapeutic approaches, such as prion protein aggregation inhibitors and gene silencing strategies. While a cure remains elusive, these efforts offer hope for future breakthroughs in the fight against this devastating illness.